Laser surgery by Jonathan Vega. What is laser surgery? Laser surgery is anything that has to deal with using a laser beam to cut through the human body. People who have heard of these stories of getting laser surgery that can change a brown eye to a blue eye just by removing the tissue on the eye and later heals itself back with a different eye color. What is used in laser surgery? The machine used to help with surgery is called a lens with the capability to help in eye surgery rather than doing it physically, which can cause harm and add too much pressure. But with the new machine lensor, it's able to cut the eye with great precision, and it's much more efficient because of how fast it cuts the eye into really small chunks. That then allows the doctor to simply suck it out with a tube, and it's done. The man who invented laser surgery was called Dr. Golem Payman, a man who wanted to use laser beams for something more, and decided to see if the laser beam was able to cut the eye for surgery. The man was born in Iran. After his studies in Germany, he began to go to the hospital in New Jersey as a doctor. From there, he started to look into surgery and later on began making improvements in his work. The machine itself, Lensar, IntelliAxis, Index OPD, Scan 3, iris registration, and small laser beam. The Lensar machine explained IntelliAxis is the camera of the machine allowing the doctors to see what they are looking at more closely. The Nedic OPD Scan 3 is the touchscreen of the machine that helps transfer data from the IntelliAxis and iris registration to itself. The eyes registration pinpoints the patient's eyes, helps guide the laser beam where to cut, and gives it the best clean cuts. The small laser beam attached to the machine isn't as big, but it's strong enough to cut the eyelid and be moved by the doctor with the machine. Pros and cons of laser surgery. Pros is that it can clean cuts with precise aim, less bleeding, less damage to the eye, much quicker when doing operations compared to manual, much safer than using tools with a high. The cons for laser surgery is can have damage if the laser cuts wrong. People have lost their sight from lasers, dry eyelids from the laser, problems seeing a few days or weeks, problems seeing at night. How to reduce the risk. People often would reduce risk by having a patient on bed with their eyes open and use anesthesia to help the patient relax. The picture to the left depicts how a machine would be placed. Sometimes it would be use an object that opens the eyelids for the machine in case of somehow close their eyelids. Conclusion. From this From all this data and knowledge, we were able to gain that the laser surgery is really good, but it does have its flaws. There have been cases where people lost their sight from a poorly performed surgery. Eye surgery with the machine is much safer because of how it does not harm the tissue once the cornea is cut up into pieces. That allows the doctor to insert a small sucking device to grab all the pieces of the cornea. This kind of technology is great for surgeons in the future, and the advancement in learning more about this technique can help reduce imperfections of dissecting a person. The bibliography.